Seeing an 18-year-old patient who is 2 weeks post-op ACL reconstruction. She says she's reporting her pain at a 1 out of 10, which is good, but we did notice she's having trouble activating her quadriceps during therapy, as well as shows an extensor lag when doing a straight leg raise test. With this said, today we're going to be using biphasic pulse current NMES. The main focus for this is to help re-educate and to also strengthen her quadriceps. So overall, for electrical stimulation, main reasons why we use E-stim is to activate skeletal muscle and neuromuscular re-education, as well as pain modulation to improve blood flow, to prevent or reduce edema, and to also facilitate tissue healing or wound healing. Specifically for NMES, main indications would include ACL reconstructions as well as TKAs. Some precautions we want to focus on include make sure that the patients have intact sensation, compromised skin. We don't want to put the pads over growth plates, and we want to make sure that they don't have peripheral vascular disease, as well as like adhesive allergies from the pads as well. Some contraindications that we want to look for is to make sure that they don't have pacemakers. We don't want to put the pads over the carotid bodies or arteries. We don't want to put the pads over eyes or gonads. We want to ask our patient if she is pregnant, because we don't want to put the pads over the lumbar, hip, or pelvic regions. And absolute contraindications, we would make sure there's no active cancer, DVTs, epilepsy or seizure disorders, or cardiac abnormalities. And those would probably be the main things that we're focusing on with that. Like I said, the main purpose for this is neuromuscular re-education and strengthening for the quadriceps muscle. When we use NMES, this is used for when the peripheral nerve is intact, and we're trying to get the same result as if they were using exercise as their modality. It's primarily used to treat those with muscular atrophy from disuse or immobilization. And then another goal is to focus on the production or force production of muscle when recruitment is most impaired. Hi Audrey, my name is Emma Nieves. I'm your student PT today. How are you doing?
I'm good, how are you?
Good. So I hear you're recovering from an ACL?
Yeah, I tore my ACL skiing.
Oh no. So what we've noticed and what I've heard from your notes, that you do have a problem with just activating these quad muscles, is that right?
Yeah.
And then when you go to raise your leg straight up, you have an extensor lag, is what I heard. All right, so because I heard your pain's not that much, it's at a 1 out of 10, we're going to try something called NMES. Basically, I'm going to put these electrical pads on your quad muscles. It's going to help with strengthening for your quads and neuromuscular re-education. It's going to kind of mimic what exercise would do, but because you're in this early stage, we're not going to do exercise, so it's just going to mimic of what that contraction would be like. Do you have any problems with like adhesive, like bandages or anything like that?
Like allergies?
Yeah.
Yeah, no.
No. And then any pregnancy or DVTs or pacemakers, anything like that?
Nope, I'm healthy otherwise.
All your sensations intact?
Yep.
All right, perfect. So is this all right with you that we do this? All right, perfect. So we'll get it set up. All right, so I'm gonna put these pads on you. We're gonna put them at somewhere called the motor point. It has the most motor end plates, so it should be the most comfortable, and we should get the best contraction when we put it on here. So when we start this, I'm gonna have you practice and contract with your good leg, and do a full muscle contraction of your quadriceps for me. When you do 100%, when we do this side, we want about a little greater than 50%, or what you can tolerate the most, okay?
Okay.
So we don't want you to be painful. It's probably gonna be a little uncomfortable, but we don't want pain, okay?
Okay.
Alrighty, so when we start this up, we're gonna put this on biphasic. I'm gonna set it up at 10:30. This just means the time it's on and off, 10:50, because you don't have really any pain. I'm not worried about that, so we'll do 10:30. And then we'll put this up to 2.0, so it's the most comfortable. For frequency, it's set at 50, which is good, and the width is 200, which is what we want. When I start this, we're gonna do, I'm gonna go super fast when I do the power intensity, just because if I go slow, her muscles could become used to the intensity and not really react to what we're looking for. So we're gonna start this. And you let me know when you first feel like your muscle, like you feel the stem. It's gonna feel like this little like tingling.
Okay.
And then we're gonna look for a muscle contraction, all right?
Okay.
So I'm gonna hit start. And you let me know when you feel something.
feel tingling, but that's it
Tingling?
so far.
All right, so we're gonna keep going. And when we do this, like I said, when we get a muscle contraction, let me know, and then we want to hit about a little greater than 50% of what you're tolerable at. Oop.
I think it's contracting.
Yep. So I'm gonna hit start. And then you'll feel it contract and then relax. So when it contracts, you want to go with the contraction and extend your leg and contract that quad. And then when it relaxes, you can just relax.
All right. So am I extending as hard as I can?
Yep, you're going to try and push this knee down. Not as hard as you can, like we said, like around 50%.
Okay.
Or what's most tolerable. But yeah, you want to push this knee down into the table when you feel that contraction going on. Feel right? No pain? When it
no pain. Okay. Just a little weird, but it's okay. Oh, it's on again.
Good. Contract, contract, contract. Very good. All right, we did 2, so we're going to stop it at there. So I'm just going to hit stop. Turn this machine off. And then we're going to remove these pads from you. Before we started, I did notice that you didn't have any open wounds or anything, so you were good to go for that. And it seems like your skin's still intact and you didn't have any problems with the adhesion. Alrighty, you're good to go.
Thank you.